So the angle in which I'm going to speak on in relation to reducing health inequality is with regards to the role of representation. So basically speaking on empowering voices, enhancing health, and how representation helps or is crucial to reducing health inequalities. A male baby born in the North Borough of Westminster has an average life expectancy of 76 years, while a baby born in Knightsbridge, Belgravia, has a life expectancy of 94. 18 years difference. This is with male. However, when it comes to females, it's actually a 9 years difference. This I read in one of the sort of recent reports that was produced by council, and it's actually, obviously, I'm sure you guys can agree, it's quite a shocking statistic, and apparently one of the worst within London or within the country. I need to clarify that one, but essentially, you know, when you hear about these statistics, and I'm sure you've heard many others in relation to health inequalities, for example, more so on a global scale when it comes to maternal mortality, especially amongst Black mothers. We had, you know, several health inequalities become, let's say, more revealed as a result of the COVID-19 pandemic and how it was disproportionately affecting individuals. And just in general, when you hear of these statistics, you honestly think, why does this exist? Why should there be a disparity depending on where you live, or a few other characteristics that we'll go into? But it just goes on to highlight how, in some cases, the more deprived you are, the more likely you are to experience a poor health. But we need to understand that health is a fundamental human right for everybody. However, representation does have a pivotal role in mitigating these health inequalities. And this is what I'll be speaking on today, sharing a few ways in which it does have ways in which we can all go away today and implement those few calls to action. But briefly, yes, Priscilla read my bio out, which I always find it very cringe to listen to people reading that out. But essentially, I am passionate about bettering worldwide inspirations, access to quality education, health, equality and diversity, and female empowerment. So those are the key areas that I'm passionate about. Currently, my day job is I work as a doctor. I'm currently in my F3 year, which means I just finished foundation program training last August. I'm currently taking a year or so out to locum, but also focus on the other hats I wear, but ultimately looking to hopefully train in general practice. Beside that, working as a doctor, I do quite a bit of speaking, but also I am very heavily involved in non-profit activity. I run two charities. First is Melanin Medics, which is a UK-based charity focusing on widening aspirations, aiding progression and enhancing diversity amongst doctors within the NHS, ensuring that we have more African and Caribbean students trained, but also retain them in the system in order to become great representatives and also work towards reducing health inequalities as well. The second charity is AKAYA, which is registered both in the UK and in Ghana for young girls in relation to their leadership development, but tackling three key pillars, which is education, health, and empowerment. Then I sort of advise and sit on a few other boards as well, but that is me in a nutshell. Key topics for today: understanding health inequalities, looking at the power of representation and what strategies can we implement. A lot of the times, I'm sure you've probably had discussions or heard lots of talks around these areas, but sometimes we often just stop at the talks and then there is no follow-up, there is no action that we then implement, or tools, or let's say actions that you can actually lead to go and take and actually do. So it's very important that we sort of go through some of those. I'm happy for anybody to share their questions or engage during the talk to facilitate a bit more of a discussion. But yes, those are the three key areas we will be speaking on. Understanding health inequalities. Well, what are health inequalities? They are systematic and avoidable differences in health outcomes. Key thing is they are avoidable. And it's like once you hear that this is something that is avoidable, almost immediately it should come to the forefront of our minds, that, okay, well, if it's avoidable, this is something we can definitely see or treat as an urgent priority in order to basically negate them and get rid of these health inequalities. They are as a result of multifaceted factors. For example, race. As you can see, depending on where you live, which part of the country, which part of Westminster within itself you live is also a factor. Gender plays as well. And there are so many other factors, including disability, sexuality, that come into play with health inequalities. But we have to understand the magnitude of issues surrounding health inequalities. And recently it was found that over 1 million people in England died over the last decade, from about 2011 till recently, prematurely due to health inequalities. And again, I've mentioned that health inequalities are avoidable, but we've had over 1 million people die over the last 10 years over something that is avoidable. The bottom line is lives are being lost. And this is something that I highlighted in my TED talk I did, was it a year or two ago? 2 years ago, and titled "Representation Will Create Medicine That Saves Lives." A lot of the time we read these statistics and actually forget to associate or link it to the fact that people are actually losing their loved ones as a result of something that we can completely avoid. And it's therefore, that should be more than enough of a reason for us to implement solutions, implement policies and ways in which we can work together to actually stop further lives being prematurely lost as a result of health inequalities. So for Westminster City Council itself, where you live or the area you particularly live in within the council, as well as race, what race you're from, are some key factors which are affecting or link heavily to health inequalities. And from one of your reports, actually 40% of the population are actually Black, Asian, or other non-white ethnic backgrounds, and 30% of the residents do not have English as their main language. Now, I mention these two because it's actually quite crucial. Representation in this talk, obviously it covers across the board in having different individuals of various characteristics, but I'm going to speak especially more so on race today. A large proportion of the council is made up of ethnic minorities, and of those ethnic minorities, quite a significant proportion also do not have English as their main language. So this taps into the area of communication. But what impact does this have on individuals and communities in general? How does inequalities affect those who are affected by it? Of course, it's going to have a personal toll on individual well-being, especially if you are an individual that lives within those certain communities and you're being told, well, if you live here, you're actually going to die earlier. Imagine the mental toll it's going to take on you, and you actually just continuing to lead your daily life. And then when you're being told, okay, well, perhaps when you do go to see your doctors or go for health consultations, you're being advised to do all these positive health behaviors. But then in the back of your mind, you're thinking, well, what's the point? Because if I live in this particular area already, the numbers are telling me I'm going to die earlier. So what's the point in perhaps taking on positive health behaviors? So again, there is a lot to play on the individual's mental health and their well-being here. Another thing is it actually widens the gap, thus affecting social cohesion between the various communities that might exist within the area. For example, already we know there is quite a bit of a gap, and more so in other societies than if you want to compare it to others. However, a gap in between the rich or poor, those who are more wealthy, those who are less wealthy. In this case, those who will live longer versus those who will not live longer based on the areas, which will affect the ways in which communities can actually come together and work together and perhaps tackling some of these issues. Of course, there are public health implications in relation to, I think, some of the key issues that are affecting the council are, which also predominantly affects Black and ethnic minorities in relation to obesity, being overweight, diabetes, hypertension. These are all implications which then also have more of a toll on the healthcare systems within the area, because that then strains are already strained NHS. Future generations, if we continue to, I guess, go along the trajectory that we currently are in the way individuals are being impacted or affected within these particular communities, it trickles down into their children, into their children's children, whereby we will see health behaviors, negative health behaviors perhaps being continued to pass down further generations, and we will not see an end to the problem. But one important thing here is we need to empathize with these lived experiences. And in order to be able to understand or know about these lived experiences, we need to speak to those individuals who are actually going through it. But the first step, obviously, is recognizing the impact that this is having. And once you are able to understand the impact that this has on individuals and in those particular communities that are affected, that's the first step towards actually understanding what is needed and what can eventually be implemented to avoid further lives being lost. Power of representation. So we hear representation a lot. We hear the words health inequalities a lot. We hear quite a number of words in relation to this space quite a lot. I often term them as buzzwords. But I think representation is a term that we should definitely never let go of. And that's the fair and inclusive participation of diverse voices, perspectives, and experiences in the decision-making processes, policies, and practices that shape the healthcare system. Key point here is active or fair and inclusive participation. But in general, let's say across the board, and sometimes we actually misuse the words representation because we just think, oh, well, if we have an individual of a certain background or characteristic here, that's our job done. But what exactly are we, what exactly are we trying to get out of having an individual of a particular characteristic or background at this particular table, which we'll go on to discuss. But again, it's fair and inclusive participation of diverse voices, perspectives, and experiences in the decision-making processes, policies, and practices that shape the healthcare system, or in general, the governance of the various communities. The problem, however, is when there is a lack of representation, issues affecting others or them, issues affecting others become a them problem when there is a lack of representation. And this is where we start to see issues, or this is where we start to see health inequalities becoming a never-ending conversation, because already if our board makeup not as representative as it should be, the perception of some of these issues is, well, okay, well, it's only in a way affecting other people, so we'll try and come up with a solution to try and help them, which scales onto inattention. Lack of focus becomes targeted on those areas, which then leads to inaction. Nothing tangible gets done. In some cases, we've seen no sort of gesture of even any recommendation. And this was a few years ago when it came to Black maternal health. One of the reports that was released by the government clearly stated no recommendations can be provided at this time, which is quite astonishing when you hear statistics at that time of Black mothers being 5 times more likely to pass away and give birth. So again, inaction, which leads to us continuously hearing about these statistics, we're more than happy to put them in the news, write them in our reports. But when it comes to what we actually go to do about it, that's where there is silence. So the 2022 reports from the council, Making Health Everyone's Business, I actually screenshot the front cover because this title I actually resonate with. I think the title of the report is very crucial because the fact that, yes, some of these health inequalities predominantly affect individuals who live in deprived areas, who come from ethnic minority backgrounds. However, this issue cannot or will not be solved or combated if we continuously think that this is their business. It has to be everyone's business in order for us to tackle and in order for us to actually get to the bottom of any of this. Where does the power of representation really lie then? So again, in the meaning of about inclusive decision making, and that means not just hiring individuals because they probably tick the box of being black, they tick the box of being female, because they tick the box of, oh, they grew up in a deprived part of Westminster. It's also about ensuring that when you do have these individuals at the table, they actually have a voice, they have a space to share their opinion, to share their lived experiences, and also a space for them to actually come up with solutions that they know that their community needs, because they are there within the community themselves. That's more so within the inclusive decision-making aspect. Then it comes, we also move on to cultural competence, which is another term that we're increasingly becoming more aware of. And that's basically understanding in many cultures that individuals come from, understanding their culture, their background, and using that to implement or affect the practices that you deliver as a body, as a council, as healthcare facilitators within the communities. That also links on to then being able to build trust, because once you understand where your community comes from and some of how it influences the way they lead their lives, that way you are able to build trust. Another thing is representation has a crucial role in addressing health disparities, similar to what we've been mentioning, and therefore improving health outcomes. And lastly, community engagement. I think this is going to be sort of one of the main sticks within this talk, is community engagement. This is something that we often underestimate the power of, especially when it comes to our community leaders, community healthcare workers, community organizations who work on the ground, who are representative organizations within themselves. Having them involved where the power lies, that is truly, I think, one of the keys to us actually moving forward. But of course, it's easier said than done. And I actually want to, well, I've included this image here, which I've included it much bigger on the following slide. But just on the first point, when it comes to implementing representative initiatives or representative solutions to tackle health inequalities, of course, there will be challenges associated with it. And number one is resistance to change. We are so stuck in our ways that when it comes to bringing about a change within a system, it looks like it will probably take 100 years or so. Good example is the NHS itself. When it comes to, the vast amount of health advancements and technology that we've been able to have globally, for example, when it comes to implementing some of these necessary tools within the NHS, it actually takes a lot of time. And it gets to the extent whereby I've spoken to actually health tech individuals who say, well, looking at how long it will take to get my tool that could save lives implemented in the NHS, there's honestly no point, because we make it so difficult to bring about change within systems that are especially quite old. But this image will literally sort of explain how, if you fix the system that is already sort of crooked or already leaning or favoring one particular side of the population, That's the only way in which we can then ensure that we can give everybody equal and fair treatment. So on the top left-hand corner, we have inequality. We have a tree that is already leaning towards the left, so that already the system is favoring one side. Looking at the tree, there are more apples on one side, and the person on the right-hand side is sort of lost, looking up into thin air, barely any apples, can't even reach, and not even falling. This depicts already the unequal access to opportunities. In this case, we can perhaps relate it to access to healthcare. So we then decide, okay, well, inequality, how we can tackle that is, let's just be equal. About equality, health equality. Equality means literally giving everybody the same tools and help. But we actually realize, as this image depicts, that's not really what we need. Yes, you've given everybody a ladder, but has that helped solve the problem? No, it hasn't. In fact, it's given the person on the left-hand side a much better outcome. They're closer to the apples, they can pick their millions of apples on their side. However, the person on the right-hand side, yes, they're closer, but they're still not able to, access those opportunities. So now we are realizing, well, equity is the answer to solve some of these inequalities, and equity is providing individuals with the custom tools that they need in order to address the inequality that already exists. Equity is very important, because in this case, we've now provided the person on the right-hand side a taller ladder for them to reach the tree. So they are now starting to access opportunities, but looking at the opportunities is still favoring the left-hand side, and this is where justice comes into play, where we fix the already broken system. But like I said, it's easier said than done, and when you have a system that's been for a long time, bringing about change does not come easy. Another thing is lack of awareness or understanding. And this I'm actually going to question, because being frank, it's 2024, and if individuals are not understanding that diversity, equality and inclusion are necessary for not only the betterment of your organization, then there is seriously a problem there, especially if you work within the realm of trying to tackle health inequalities and having an awareness or understanding. You have to question yourselves. Next, there's a risk of tokenism. We say we want representation, but then it's like you fall into the risk of, okay, well, we just need to make sure organizations have at least one Black person, at least one female, and then you just serve it as a tick box. But it goes beyond being a tick box, and it goes beyond just having one person of a particular background just to sit at the board and basically there for show. Like I mentioned, it's about having them involved in the decision-making processes as well. Number 4 is limited resources, which I will also go on to speak a bit more about. And this relates heavily to the community as well. Sometimes, or more often than not, I'm not exactly sure with the case of the Westminster Council, but sometimes, let's say, funding for helping to tackle a lot of these issues can be quite limited, which means the work that individuals can actually do can only go so far. Next is data collection and measurement challenges. Once we sort of, let's say, recruit representative boards or representative sort of tables where individuals can help make decision making, we just think that ends there. Okay, well, we've recruited somebody and that's it. We have to ensure that we continuously monitor and evaluate our DEI strategies. Next is communication barriers. Highlighted that 30% of individuals within the council are actually, English isn't really their first language. So when it comes to tackling some of these issues, you have to be able to come to these individuals' level and communicate in a way that they are able to understand. And if you want individuals to, I guess, for example, follow positive health behaviors, you need to be able to communicate that advice in language they can understand in order for them to act, or in order for them to carry out the necessary activities to help better their lives. Another thing that we also don't often talk about is intersectionality. When it comes to representation, yes, a lot of the focus is on race. But however, what if you have two characteristics that are sort of seen as a disadvantage? In my case, yes, I'm Black, but I'm also female. And there are particular challenges that females face compared to males. There are also particular challenges that Black individuals face compared to individuals of races. So when you have those two characteristics on top of each other, you have a community or a population of individuals who experience unique challenges compared to others. And those needs also need to be met too. Lastly, sustainability, which sort of taps into what I mentioned previously in relation to, we think representation just stops at recruitment, but it goes on beyond that. So strategies for enhancing representation, and I've mentioned some of these already, but policy reforms that mandate diverse representation. In a way, we've gone beyond, okay, the simple advice of make sure your recruitment processes are sort of diverse and representative, to now some organizations actually implement a percentage or a quota that needs to be met. Which me personally, I'm in two minds about, because it's in a way you're painting it to be sort of like a numbers exercise. But then again, it's like, if your organization has reached a point of, well, you need to set a target for it, then clearly there's a problem and you're going to have to do what you need to do. But it's about what you then do with those diverse voices, which I guess sets you apart from the rest. And that links into the evaluation continuous improvement. We need to monitor our representation metrics, but also get feedback from these individuals and understand, well, currently in your position, how do you feel? Do you feel as though you're being listened to? And get some more feedback from how they feel within those current situations. Next is training and education, which is very, very important. Sometimes some individuals often don't know how to go about these things. For example, with cultural competency, with reducing bias, with being able to effectively communicate with the different communities that we seek to serve. But the problem with training and education is sometimes, more often than not, it's online modules that you simply just click through. And I've personally been guilty of this. When you have DI training that you're supposed to do in your own time, you probably just skip through the content and then you have a little mini assessment at the end. That's not effective. What needs to happen is actually, whether it be virtual or in-person training, that is mandatory for all individuals to take part in, but also use these training opportunities or education opportunities for individuals to voice and have crucial discussions about some of these topics, because it can be quite difficult. And in these areas, let's not forget about educating allyship and advocacy as well. Next, community partnerships and community health workers. And I put exclamation mark, because really, honestly, it is like, it's no brainer. You have individuals or organizations or groups within the community that are directly affected. They know what they're going through. They perhaps know the solutions. They are the key to communicating with the local communities. It's about partnering with these individuals, with these local champions, with these local health workers, and ensuring that we come together in order to reduce these health inequalities that exist. But again, when it comes to community work, and I speak from experience, especially with Melanin Medics and our work that we do with African and Caribbean individuals, when it comes to sort of tackling racial diversity within medicine, is a lot of these individual organizations are actually just charities, and it's just individuals that come together who volunteer their time for the betterment of their people, let's say. And so if these organizations are able to do so much with so little, you can only imagine how much they are able to do, how much influence, how much help they can have within the council if they are provided with the necessary fund, facilities and services that they need to carry out these activities that they need to. And then also there's a mention of public awareness and education, having public campaigns within the area, as well as having community forums whereby you can have individuals come and share, but also get them involved in perhaps not only formulating strategies, but also being able to work in partnership with yourselves to deliver these strategies to overcome. So some success stories. These are from a few other areas within London that I came across, and the key thing with both of some of these strategies is the fact that they had involved the local community when it came to building these frameworks or responses that they had in order to tackle some challenges. So, for example, the one on the left-hand side is relating to ensuring that children and their families receive the interventional care that they need. And with this, they worked with families directly to design the system in order to help reduce that inequality. The one on the right-hand side is about creating healthier spaces outside of schools. And, you know, obviously the target schools were those more so in the urban environment, whereby they had a lot of children who were obese, with reduced air quality around their schools, violence, including knife crime. And what they did was they worked with the local neighborhood. They formed partnerships with the local neighborhood and granted them a voice in order to also work towards coming up with a response, and also worked with them and helped to deliver the response as well. And then I'll screenshot the Melanin Medics website. As an example, we're a non-profit organization working towards diversity within medicine. And we've been operating for about 6 years now. This is our 7th. We're going to hit 7 years in a few months. And we've been able to do so much in sort of increasing the number of Black doctors that are now working within the NHS since we first began. And so those are just a few examples of success stories whereby you involve individuals working with the local community and developing some of the frameworks and programs can be used to help. And I'm sure maybe the Westminster Council also has some success stories. You guys also have some success stories of your own as well, which I'll be more than happy to hear about at the end. So the call to action. But again, let's remind ourselves that persistent health inequalities exist within communities, not just in Westminster, not just in London, not just in England, to be honest, all around the world. However, it's important to know that representation is a powerful tool in addressing these. So let's actively participate in promoting representation. We need to assess our own roles within our own spheres of influence, no matter what your role may be in, no matter what job you work at. We all have a responsibility to, I guess, assess and think, well, how can we use our voice in order to help reduce health inequalities, whether it be within the workspace, within our community spheres, or personal networks. We need to encourage participation in community initiatives. As I shared, community is very, very powerful in trying to reduce health inequalities, and we need to build better connections between individuals and the organization. Ultimately, we're all working towards similar goals, or this, if not the same goal. So we have to create a better network of advocacy, a network of collaborating with individuals as we work towards a common goal. Inspiring leadership and advocacy as well. We need to encourage individuals to seek leadership positions. You may have individuals who may be from those deprived areas, from ethnic minority backgrounds, who you may deem to be, or actually, you know, your voice is actually quite crucial here. You are somebody that individuals look up to. You are somebody that can actually qualify to be in this position, and you are somebody whose voice will be very, very useful or crucial to some of the issues that we discuss or want to tackle. So encouraging them to actually seek those positions in shaping policies so that we promote representation. Another thing is mentoring and reverse mentoring too. It can go both ways. Sometimes we think it's always the senior that has to lead the junior, but it can actually go both. And in this case, reverse mentorship or reverse mentoring can be in the form of individuals in senior positions within the council or within the healthcare facilities or within the healthcare delivery areas within Westminster, being paired with community leaders, community individuals, or those who work within the space, and them actually mentoring each other. So forward mentorship in relation to leadership development, but also it goes the reverse way in relation to actually understanding some of the issues that affect the individual that is being mentored and how we can actually come up with solutions. So, important note here is to check yourself. We all have individual biases. Nobody is innocent. But it's important that we self-reflect on these personal biases and the role that it may play in perpetuating disparities. For example, common bias that exists within healthcare, especially as medics, is some individuals, you may come across, let's say, some patients who refuse to be treated by, for example, healthcare professionals who are Black. And then when you delve into perhaps the reason why, it's because individuals have a bias or a stereotype of thinking, well, if you are a particular ethnic minority, you're not as qualified as somebody else who is of another background. And so obviously that is not true, because we all go to medical school, we all achieve the same qualification. However, individuals just have this deep ingrained stereotypical thoughts or personal biases against others. And so it's about us checking those, eliminating those, but also remembering that sometimes when you don't check yourself, this actually affects the work that you then produce, which is very important, especially in healthcare. There's a quote that we love to use at Melanin Medics: start where you are, use what you have, and do what you can. A lot of the time, I mean, which is understandable, you know, when you hear about health inequalities, you think, well, there's such a huge area, such a huge topic. Where do you even begin when it comes to tackling it? However, it's important that whoever you are, wherever you are, whichever role you have to play, just start where you are as an individual, using the tools that you currently have within your reach and doing what you can. As individuals, I remember that I mentioned our voices are very, very powerful. How can you shape or affect representation within the fields that you currently operate in? Think about how this applies to your context within Westminster, and how you are also going to use your voice to save your local lives. Because remember, once again, inequalities isn't just a numbers game where we just, okay, well, if you live in this particular area, you're going to die earlier, or if you are Black or if you're Asian, you're also going to die earlier because you are more likely to live in those areas and also have these certain negative health behaviors. It goes beyond that, and it goes to the extent of people actually dying prematurely as a result of it. And as you have identified, whereas it being 18 years for men, 9 years for females. So how are you going to use your voice to save your local lives? I've spoken quite a lot, but I do want to say thank you, especially to Priscilla and Christine, for having me, inviting me to speak about this very, very important topic. This is a QR code for you to scan if you want some further details, how to connect with myself. There's also a link to the TED Talk on representation will create medicine that saves lives for you guys to listen to if you're interested. But I'm happy to answer any questions that anyone may have. So yeah.
Thank you so much. That was really informative and quite inspirational for me. Actually, I've taken some things away to support me in some of the work that I'm doing. In the meantime, my question is, in terms of, you've spoken about resistance to change, and specifically just around representation, what are some ways in which you would encourage people who are trying to create change within their organizations to overcome, like, people that are resistant to it, or because I guess in some of the work that we're doing, what we find is that people are comfortable with the system. Obviously, they've seen results with the system that they've been working with, and so when you're bringing new ideas, they often feel like there's no need because this is already working. So how do you go about encouraging, like, I guess not necessarily saying that we're better, but forming those relationships and then bringing in like new ways for change?
Yeah, no, I think that's a very good question, because it's also something that we experience a lot within the NHS as well. Change is difficult for anyone, and when you've been so stuck in your ways with doing something in a particular way for a long time and you think it works, you think, well, what's the point? However, you then have to question yourself and think, well, if we are now being presented with something different, then obviously there is something to really think about here. Because if we can do so much more, then, or if we didn't need to do so much more, you wouldn't have come to me to present something new or different. So a lot of the time, what really helps is having evidence base, because when individuals are faced with the facts, it's very hard for you to say no. And then sometimes when it comes to these sort of environments, most of the time it's very much there's an age element, because it's typically young people coming with the new innovative ideas approaching the older people. And so what I always sort of also like to encourage is having or presenting such ideas in a group form to seniors, because it's much more harder to say no to an idea that is backed by so many individuals who are more than capable, as opposed to one person who you think is just sort of stepping out of line. Yeah, those are some key advice I would give at the moment. Yeah.